Good afternoon, everyone. I want to provide you with a further update on Scotland's response to the COVID-19 epidemic. And firstly, my apologies for the late start today, but there are a couple of issues that I want to address today in some detail, so please bear with me. And some of the information I'm about to share took a bit of time for us to verify this morning. Firstly, I can confirm that as at 9 o'clock this morning, there have been 2,602 positive cases confirmed. That is an increase of 292 from yesterday's figures. As always, we want to stress that these numbers will be an underestimate. A total of 162 people last night were in intensive care with confirmed or suspected COVID-19. That's an increase of 15 on yesterday, and a total of 1,282, which includes the intensive care patients, are now in hospitals with confirmed or suspected COVID-19 across Scotland. Now, I'm going to take a little bit of time today to talk about the figures of deaths that we are sadly reporting. But before I do so, let me stress that every single death from this virus is a tragedy, and my thoughts are very much with the families and friends of all those who have lost their lives. We know that one of the most difficult parts of having a friend or family member die from COVID-19 is that the very nature of this virus means that family cannot be there at the time of death. And as we have talked about previously, only limited numbers of family or friends are able to attend funerals right now. So it is a particularly cruel virus in that respect. If I can turn now to the numbers of people who have sadly died from coronavirus since our last update, and as I said, I want to spend a little bit of time on this today to ensure maximum understanding. The figure for today, based on our method of reporting so far, which, to be clear, comes from Health Board notifications of deaths with a laboratory confirmation of COVID-19, would be 10, which would have taken the total to 86. However, we've also been advised overnight of an additional 40 deaths that had not previously been notified due to delays in family liaison. And that means that the total number of deaths in Scotland is now 126. However, it wouldn't be accurate to add all of the additional 40 deaths to today's total. They will require to be distributed over a number of days, and we will seek to provide that further detail later today. However, to reiterate, it does mean that the total number of people with a confirmed COVID-19 diagnosis who have died in Scotland is now 126. I can also confirm today that because the numbers of deaths are unfortunately rising as the virus continues to spread, it is necessary to make some changes to the reporting system to ensure that as we go forward, it is as robust and as up-to-date as possible, and also as comprehensive as possible. So these two changes are as follows. Firstly, from now on, the daily figure of confirmed deaths reported by Health Protection Scotland will no longer rely simply on notifications by individual health boards. Instead, HPS will use validated National Records of Scotland figures. In short, what that means is that the daily figure reported will represent the number of laboratory-confirmed COVID-19 cases confirmed through the NRS death registration process for the preceding 24 hours, ending at midnight the night before. And the second change is that as of next week, NRS will also start to report on deaths where COVID-19 is mentioned on the death certificate. And this will include not just confirmed cases, but also presumed cases, and it will cover all settings, including hospital and community deaths. Let me also say that as the number of cases and deaths rise, the issues of patient confidentiality associated with small numbers become less relevant. So from next week, HPS will also be seeking to publish much more detailed breakdowns of these numbers, and we will give more detail of exactly what that will entail over the weekend. Now, I appreciate that this is quite technical information, but as this situation develops, we are determined that information continues to be as accurate, up-to-date and comprehensive as possible, and that we are being as transparent as we possibly can be. We intend to do a briefing for journalists over the next couple of days, specifically focused on death reporting, to ensure that any questions about these changes can be addressed and the basis of reporting as we move forward is fully understood. The two other issues we want to address today are also subjects, both of which rightly have attracted a great deal of attention. The Cabinet Secretary for Health will say more shortly about personal and protective equipment, or PPE, for those working in health and social care. Over the past few days, we've taken significant action to improve both the supply and the distribution of PPE to frontline staff. Today, Health Protection Scotland is publishing revised guidance on when and how that equipment should be used. This revised guidance is intended to build confidence in the health and social care workforce that they are being properly protected. The revised guidance has been produced on a UK-wide basis with input from Royal Colleges and expert scientific groups, and it reflects the more advanced stage we're now at in the spread of COVID-19. The second issue I want to talk about in just a little bit of detail is testing. I want to briefly summarise the situation here in Scotland and cover the ways in which we are working to rapidly enhance testing capacity. And as part of that, it might be helpful to briefly give just a bit more context on what testing can and cannot achieve. At the moment, all NHS COVID-19 testing is what is called PCR testing. These PCR tests are effective at identifying people who have the COVID-19 infection at the time they have symptoms. However, these tests cannot reliably detect the virus during the incubation period, i.e. before the person has symptoms, and they cannot confirm whether a person has had the infection once they've recovered from the illness. In future, we also hope to be able to offer a different type of testing, what is called antibody testing, which would indicate if a person has had the infection. Now, these tests are not yet available in a reliable form, but the Scottish Government is working with the UK on this, and we hope that validated tests will become available soon. But that means, as of now, we have three priorities for the diagnostic PCR testing that we do have available. As you would expect, we need to test those who are most seriously ill to support the care that they get. Secondly, we need to undertake testing so that frontline health and social care staff who have symptoms but not the virus can return to work if that is appropriate. However, when a healthcare worker is self-isolating because a family member has symptoms but they don't have symptoms, then testing the healthcare worker would not be effective. So on occasion, this strand of testing will involve testing family members of healthcare workers who have symptoms. And if they don't have the virus, the healthcare worker can then go back to work. I can confirm today that so far we have tested a total of 3,400 NHS workers or family members, and we expect that figure to rise considerably in the days to come. And thirdly, we need to use testing to assess, monitor and report on the spread of the virus across the country, surveillance testing. And that is in a way similar to what we do for flu every year during the flu season. Now, to enable us to test in these priority areas, rapid increases in testing capacity are taking place. Initially, when this outbreak first started, we were able in Scotland to test around 390 samples a day. That capacity has already increased to up to 1,900 tests a day. And we're building towards being able to carry out at least 3,500 tests a day by around the end of April at the latest. From next week, we will seek to publish daily information on what tests have been carried out. Now, there are two issues in particular I want to briefly address. Firstly, while testing key workers and their families is important, and as I have said, we've so far tested 3,400, in many cases, testing will simply confirm that an individual does have coronavirus. So while we will continue to expand testing and to expand key worker testing, that does not, in and of itself, mean that staff will be able to return to the workforce if they are found to have the virus. And a point to stress is this: in the coming weeks, as the virus continues to develop, it will become much more likely that a person with symptoms has COVID-19 than that they do not have the virus. Second issue I want to address is the procurement of tests and capacity. The capacity I have described, which we're building up, is within Scotland's National Health Service. We continue to look at ways to expand that capacity ourselves and with other organisations, and we're also taking part in 4 country initiatives with the rest of the UK, which will further add to that capacity. But these are in addition to, not instead of building our own capacity in NHS Scotland. We're very grateful to every organisation that has offered laboratory space. However, we need to be sure that testing is done in a way that is both safe and meets high quality standards so that we can be confident in the results. That's why there are important due diligence issues that need to be addressed before any new laboratory can be used. And it's why National Services Scotland has so far prioritised the expansion of NHS capacity, but are engaging as a priority with external laboratories that are better placed to meet these criteria more quickly. We're also considering how we will use more extensive testing, including antibody testing, as part of the strategy to take the country out of lockdown, though I must remind people that that may not be imminent. I want to close by once again acknowledging the extraordinary contribution of our health and social care workforce. This evening, I, along with people across the country, will again take the time to applaud the fantastic work they're doing. As a further show of appreciation, this Scottish Government building, St Andrew's House, will light up in blue. That will happen this evening and every subsequent Thursday in the weeks ahead. It's one small way of expressing our respect and our deep gratitude for those on the front line. But as I've said before, the single most important way we can show support for health and social care workers is by staying at home. By doing the right thing and by limiting contact with other people as much as possible, we can all do our bit to slow the spread of the disease, protect our NHS and save lives. This, unfortunately, is not a quick fix. We all want this phase of our lives to be over as quickly as possible. But much as I'd like to stand here and say otherwise, it is unlikely that this will be in just a few weeks. We are in this for the long haul. Hopefully, as we gather more hard data on how the virus is spreading in Scotland and on what impact these lockdown measures is having, we will be able to be more precise about when and how we can start to get back to normal. We will share as much of that analysis as soon as we can. But I want at every stage to be giving you our most informed analysis, rather than just telling people what we all want to hear and then having to downgrade that later. So please, everyone, I know how tough this is, but please, please stick with it. You are helping us to save lives. Let me again thank everyone across the country who is playing their part. Your efforts will continue to be really vital in the weeks ahead as we fight this battle against coronavirus. Thank you very much indeed. I'll hand over now to the Chief Medical Officer and then to the Health Secretary.
Thank you, First Minister. Just to emphasise that transmission of the virus is still continuing in Scotland. We have sadly seen more deaths each day that goes past. We're seeing more people who are seriously unwell and in intensive care. What we do know, though, from the scientific evidence is that if people are stringently obeying these new rules, these very difficult rules that stop us seeing our friends, stop us from seeing our family, these rules that are designed to protect the most vulnerable people in our society, those with compromised immune systems, the elderly, we are then able to slow the spread of this transmission. The fewer people that get the virus, the fewer people that will become seriously unwell, and undoubtedly we'll be able to save many, many lives in Scotland. But we must obey these rules, these new measures, these strict impact on our own lives and our livelihoods, and those across society behaving differently than we have ever had to before. The more we comply, the longer that the better that those measures are going to reduce the transmission of the virus, and that length of time that we have talked about of at least 13 weeks, we would be able to lift some of the measures potentially after that 3-month period if people are complying And if we're able to see that that viral spread is slowing and the number of people seriously unwell and the number of people dying will reduce.
Thank you, Catherine, and I'll hand over to the Health Secretary to say a bit more about PPE.
Thank you, First Minister. As the First Minister has said, urgent work has been underway with input from a range of our colleges and infection prevention and control experts to rapidly review the existing PPE guidance for health and social care staff to reflect where we are in the transmission of this virus. That review is now completed. Our Chief Medical Officer and Scotland's Chief Nursing Officer wrote to health and social care workers yesterday to make them aware that the guidance was being published, and will be writing again today to outline the key changes, which I will briefly outline now. The guidance itself recommends the safest level of PPE to protect health and social care workers and specifies the type of PPE that should be worn in various health and social care settings where patients or residents are being cared for. Importantly, new tables have been added to the guidance which clearly explain the PPE required for those different clinical and care scenarios. One of the tables relates to acute hospitals, a second to primary care, outpatient and community care, ambulance staff, paramedics, first responders and pharmacy. And there is an additional table that describes when to use PPE when caring for any patient or resident, regardless of whether the individual is suspected or confirmed as having COVID-19. This last table is important at a time when we are aware that there is sustained community transmission of the virus and the likelihood that any patient or resident having COVID-19 without any of the recognised symptoms is increased. Given the recognised sustained community transmission of COVID-19, the guidance importantly contains detailed advice around the risk assessment and use of PPE, including the use of aprons, gowns, fluid-resistant surgical masks and eye protection in that range of different clinical and care scenarios, including community settings such as care homes and caring for individuals in their own homes. The guidance also asks that organisations themselves risk assess to ensure that they provide the correct PPE for the safety of their staff. The guidance is also clear that in line with agreement from the Health and Safety Executive, in certain circumstances, some PPE, particularly masks and eye protection, can be worn for what is described as a full session and doesn't need to be changed between patients. This ensures that health and care workers can safely carry out their work, particularly when they are working in areas where there is a high risk of COVID-19 transmission, such as emergency departments or intensive care units. The Health and Safety Executive has reviewed the guidance and agreed the appropriate sessional use of some PPE. Importantly, in terms of shielding the extremely vulnerable in our society, the guidance asks that secondary, primary and community care workers should wear a surgical mask when providing care to any individuals in this extremely vulnerable group. We appreciate that this is an incredibly busy time for all of our health and social care workers, but we also know that those on the front line need absolute clarity on what these changes mean for them. So Health Protection Scotland have helpfully produced a range of visual posters and online video resources specifying what kind of PPE should be worn in which setting. These are available on the HPS website, and later on today we'll be undertaking an exercise to make sure that this guidance and that visual representation of it reaches the hands of as many of our health and social care workforce as we can manage. I want to briefly turn now to the supply and availability of PPE, as I know that there have been many questions around how the guidance changes supply. We continue to work with NHS National Services Scotland, our health and social care partnerships, the social care sector, and with colleagues elsewhere in the UK to procure and distribute necessary supplies of the types and levels required. In March, 40 million items were distributed to our acute settings, 8.8 million to community and primary care, and 4.2 million items to social care. These new measures have been introduced, the First Minister referenced, in terms of the ordering and distribution of the supply in order to streamline that and allow us to get the right PPE to the right people as quickly as possible. I want to say a word about the many unpaid carers who are providing care and support to family and friends in the vulnerable groups and may therefore need PPE. We're working with NHS, NSS to quickly put in place a system that supports unpaid carers to access PPE if they need it. And when we have worked that out, we will make sure that through a number of third sector and other organisations and local authorities, those unpaid carers know how to access the PPE that they need. We have a new dedicated email address for staff and members of the public to raise specific supply issues if necessary. That is monitored continuously and allows us then to act quickly to resolve any specific supply issues more quickly. Finally, I want to take this opportunity to say that this area is of the utmost importance to me as the Health Secretary, to the First Minister, to the Chief Medical Officer, to all of us in government, to make sure that as those health and social care workers work to keep us safe, we do everything we can to ensure that they have the personal protective equipment they need to keep them safe.
Okay, thank you very much, Cabinet Secretary. I'm now going to take a number of questions. We have a large number of questions today from journalists who are joining us online. So, again, if I can appeal to journalists, if your question has already been asked by somebody before you, please don't feel that you have to repeat it, and then we'll get through as many questions as possible. I'll go firstly to Kieran Jenkins from Channel 4 News.
First Minister, contact tracing appears to have been stopped in Scotland, contrary to what the WHO recommends. What exactly is the trigger for starting contact tracing again? And do you know how many contact tracers are trained and ready in Scotland to perform this vital role?
Well, I'm not sure that it is correct in terms of what you said about the WHO, but I don't want to get into a situation where I'm speaking for them. That would not be appropriate to do. But we set out probably the best part of a month ago in the Four Nations strategy that was published, the different phases of dealing with this epidemic. The first phase, which we were in at that time, was the contain phase. And what happens in the contain phase is that when a case is confirmed, all of their contacts, and remember there was a definition of what a contact was, it wasn't simply somebody they'd passed in the street, were traced and given appropriate advice and where necessary testing as well. And that happened throughout the contain phase. We then moved into the delay phase, which happens when transmission of the virus is considered to have reached a certain stage. And at that point, that contact tracing does not continue to happen, because we go to a situation of presuming that people with certain symptoms have the illness and ask them proactively to isolate. So we're not having to contact people who have been close to somebody with a confirmed case of the virus to say you should be isolating. We are asking everybody with symptoms to isolate, and of course everybody with symptoms is being asked to isolate for 7 days, and if you're in the household of somebody with symptoms, for 14 days. So that's the appropriate approach that we take in the delay phase. As we start to come out of the current phase of the lockdown measures, and we don't yet know when that will be, and as I said earlier on, I don't want to give people false expectation about the timescales we are talking about here. But when we come out of that, and we're already starting to think about the tactics that will be deployed there, then the use of testing and going back to a situation where we're effectively trying to contain again, and testing and contact tracing becomes much more relevant again, it is likely to be the case. And we'll of course go into more detail about that as and when we get to that stage. So that's the situation that was set out in terms of the different phases of tackling this epidemic in the action plan a few weeks ago. Can I go now to Peter McMahon, ITV Border?
First Minister, the Deputy Chief Medical Officer for England last night told my colleague Robert Peston that testing was, quotes, a side issue and that social distancing is what matters. Now, we know from the facts that Scotland, and in fact the UK, is doing far less testing than other countries like Germany. Is it the case that you and indeed Boris Johnson have simply made the wrong call when it comes to testing and social distancing?
No, and with respect, I think you're confusing a couple of different issues there, but let me try and take them directly, and then I'll hand over to the Chief Medical Officer who can say more about this. Firstly, I didn't see the comments that you refer to with the Deputy Chief Medical Officer of England, so I don't want to comment on them. I'll speak for myself, and I'm not speaking for her, nor am I speaking for Boris Johnson. But I don't think testing is a side issue, but I think it is important, as I've tried to do today, to be very clear about what testing can and cannot achieve. So it tells us right now whether somebody who is symptomatic has the virus or not. It doesn't allow us to tell us that somebody is going to develop symptoms, nor does it allow us to tell when somebody's recovered whether they've had the virus. So I think it's really important that we don't overstate what testing can achieve. Secondly, I don't think it is an either-or between testing and social distancing, because regardless of how much testing is being done in a country, what you are saying to everybody that the best way of slowing down the spread of this virus is social distancing. And that is true of people who are confirmed positive cases, but also true of those who have symptoms that might be indicative of the virus, and actually for all of us, because we're breaking the chain of transmission by complying with that social distancing advice. So it's not a choice between these two things. And lastly, in terms of where we are with testing, we have very rapidly expanded, quite dramatically, the testing capacity we've got. At the outset of this epidemic in Scotland, we had the capacity to do under 400 tests a day. That is now almost 2,000 a day, and we're building that up rapidly beyond that. What I also tried to set out clearly in my opening remarks was some of the reasons why it does take time to build that capacity, because not all tests that people might think are available are reliable. If we are to have testing as a positive part of our strategy, we've got to be able to rely on the tests, and we've got to make sure that the laboratories in which those tests are being processed are meeting the required standards. So we've been working at pace to build that capacity. I think in Scotland we are, if I look at the most current figures, I think we're slightly ahead of other parts of the UK in terms of the amount of testing we are doing, but we want to continue to expand that, and that's why we remain focused on the steps that I've set out. Chief Medical Officer, do you want to add anything to that?
Thank you, Peter, for the question. I didn't hear the Deputy Chief Medical Officer in England's comments either, but I have been saying and advising First Minister and the Cabinet Secretary for several weeks now about the distraction that I think the focus on testing may become. The testing is extremely useful, but it is only going to be positive within a short window of perhaps 48 to 72 hours while somebody has symptoms, because there needs to be an amount of virus in that person to be able for that to be detected. The healthcare workers and social care workers in particular who have been off work because a member of their family has symptoms, it is extremely important to test as many of them, but only, as the First Minister said in her opening remarks, if in fact that family member turns out to be negative, because then everyone can go back to socially isolating themselves, or as a healthcare worker to be back at work. If that person, of course, is positive, then in fact everyone's in the correct environment. They're staying away from interacting with other people. So as the virus becomes more and more prevalent in our community, more and more of those tests will be positive. And in fact, as the Deputy Chief Medical Officer in England said, it's the social distancing that's important, that people with symptoms are isolating, they're not mixing with others, and therefore transmitting the virus to other people who will transmit it to their own friends and family. So there'll come a time when actually the utility of the testing is in fact so that people can know that they have had it because they have been tested, and they then will be able to know that, as far as we know at the moment, that they are immune to catching it again. And if they're a health and social care worker, they could go back into their place of work and look after patients who are positive. But the thought that the testing in some way slows the virus or is a part of our strategy to prevent transmission is a fallacy, I'm afraid. The testing gives us more information, but the social distancing and all of these stringent measures are what we actually need to prevent spread and to prevent serious illness and death.
The final point I would make here, which I suppose links Peter's question back to Kieran Jenkins' question, is where I do think, and we're thinking about this hard already and will continue to do so, is the role testing plays as and when we start to come out of lockdown, when we're effectively going back into a contain phase, and you use testing there as part of a contact tracing approach. And that's an additional reason why we are working so hard to build up the capacity that we've got. Can I go now to Stephen Brown, STV News?
Yeah, I just wondered if, in terms of those additional 40 deaths that have been updated, where have they come from? Have they come from a particular area of Scotland? Is it predominantly from a care home setting?
It's from a particular laboratory. What we're HPS are looking to do just now is make sure we can distribute them appropriately across the different days. So what I can say just now is that while, yes, it takes the total number of deaths to a higher number than today's number would take it to, it would not be accurate to say that they are all part of today's figure. So we hope later today to be able to provide you with that information of how those figures should be distributed. Fiona Walker from BBC.
Thanks, First Minister. Considering that much higher number of deaths that you're announcing today, does this change the number of people you estimate to have the disease in Scotland, and also the way you're interpreting the progression of the disease here?
I'll hand over to the Chief Medical Officer to answer that question.
Thanks, Fiona. As you know, I've been talking about the number of deaths representing. Each death represents probably 1,000 more people in Scotland who have this coronavirus. Obviously, the vast majority of them are not diagnosed, and some of them may not be aware that they have it. So these number of deaths is something that we've now been talking about on this platform for several weeks. We expect this rise in deaths. We expect more people, unfortunately, to become seriously unwell. So I'm not surprised at these numbers, and this is why these stringent measures are so necessary. What we would really be hoping to see, and unfortunately that's unlikely for several months, that the deaths stop rising day on day, but actually start to slow down and then, in fact, to start to reduce.
Okay, Alan Smith from Bauer.
Hi, good afternoon. Just a question about police protection. The Scottish Police Federation say today that they're seeing a trend in people in custody who are deliberately coughing on or spitting at police officers. That not only threatens the safety of officers, but their families. They said there's no specific direction from the Lord Advocate's guidance as to keeping such people in custody, and they believe that the Lord Advocate's guidance should match what's happening in England, and wanted a view. I was just wondering if you would back it a view, and what else could you say to that regard?
I don't think it's appropriate for me to speak for the Lord Advocate, particularly for his actions and his prosecutorial function or advice he would give to the police. We can certainly get some information from the Crown Office about how they would deal with that. But certainly, if I can speak for myself in terms of that kind of behaviour, I certainly would think would be breaching the sort of rules that we're asking people to comply with, and certainly anybody acting in a way that is deliberately trying to infect somebody is something that I think the police should and would be able to deal with. But I will convey this question back to the Lord Advocate and the Crown Office to see whether we can get you any further guidance on how the Lord Advocate and the Crown would expect those situations to be dealt with. Greg Fluker from Wave FM.
Thanks, First Minister. Apologies if this question has been asked already. I had a slight connection issue. We're being asked every day to report on the number of people who have actually recovered from the virus. Is this something that you're able to measure? And if so, can we expect to see the figures on this being included in your briefings in future?
I'd be very keen to give details on the number of people who've recovered. I desperately want to be able to stand here and give good news as well as less good news, but I more than anything want to be standing here and giving frank and open information to people. What we are looking at, particularly as cases rises and issues of patient confidentiality become less relevant, is how we can provide much more granular detail of the figures that we're publishing. I'll ask the Chief Medical Officer if she has a view on how realistic it is to be able to report on people who have recovered, but if it was possible, we would certainly look to see if we could do it.
Of course, we don't know about people with mild symptoms in the community, and we don't know how they have progressed with their disease. Usually, it's within 7 days that those people would recover if they've got mild symptoms. We would expect at the moment our hospitalised patients really to take 2 to 3 weeks to recover. They are probably in hospital for at least a significant proportion of that time. And before they are discharged, they have further testing to make sure that they're not still shedding virus and are not still infectious to other people were they to go home. What we would do when there are increased numbers is we would be able to report on how many people are being discharged from hospital having recovered. But unfortunately, as I've said already, that will not be an estimate of the people in the whole of the country, but just those who've been much more seriously unwell.
But we will certainly consider whether it is possible to give information or even approximate information of that type. Paul Smith from LBC.
Thank you, First Minister. When it comes to PPE, NHS staff are being tested to ensure that the visors and face masks fit them correctly. And if they fail the test, they're not being given the equipment. So where does that leave them?
Well, they should be given equipment that is properly fit tested for them. As the Health Secretary has just outlined, there's revised guidance being published today, which is all about trying to increase the confidence that health and care staff has. But I'll ask the Health Secretary to say a bit more about that.
So it is only the FFP3 mask that has to be fitted to your face, and that's because it forms a seal between your skin and itself. And that's necessary for healthcare staff in particular clinical situations where aerosol-aided procedures are being used. There's a machine also that can confirm whether it is fitting properly or not. In those circumstances, if the mask that has been fitted does not fit, then that healthcare worker should be given new equipment and that it fitted and tested again. And where there are instances where that's not the case, then part of the reason for setting up that dedicated PPE email address is for people to come direct to us. It is monitored continuously with any specific instances like that, so that we can then intervene and resolve the problem, because that is not something that should be happening. People who are working in those settings, in any of health and social care settings, should have the PPE they need. Our job is to make sure it's distributed quickly and well to them, and that when it arrives, that they're able to access it and use it.
Okay, thank you. Neil Puran from PA.
Thank you. You mentioned that from next week, NRS would start recording cases where COVID-19 was mentioned on death certificates. Are we expecting quite a large rise in the number of deaths recorded when that comes in, as there'll be several weeks worth of data up until now?
I don't think I'm going to speculate on exactly what we would expect from that. I think it's probably safer and wiser to wait for the actual publication, and so that we can then talk about the numbers as they are. It will clearly, both at that point and on an ongoing basis, increase the number of deaths, because we're taking a more comprehensive overview encompassing not just confirmed but also presumed, and all settings, not just hospital but community settings as well. But I don't think I would want at this stage to be speculative about exactly what that will show. Next week, when we have that information, of course we can cover it at one of these briefings and answer questions on it at that time. Tom Martin from the Daily Express.
Good afternoon, First Minister. Just going back to the testing of NHS workers, you mentioned there the 3,400 figure to date, and I was just wondering, do you think there's a lack of readiness in building up capacity, given, I think you said at the start of the outbreak there was only capability for 400 tests a day?
No, I don't think there's been a lack of readiness. Before this outbreak, we, as will be the case with other healthcare systems in the UK and indeed in other parts of the world, will have had a certain laboratory capacity. And I recall, if I cast my mind back to more than a decade ago when I was Health Secretary and we had the swine flu pandemic, I remember then that we had to build up laboratory capacity, although thankfully then we didn't have the same kind of scenario unfold as we're facing right now. So, we're building up capacity to deal with the situation we're facing. We are doing that as quickly as possible, and the build-up has been rapid, but as I tried to outline, there are quality and due diligence issues that have to be gone through to make sure that the testing we are doing is reliable, because having tests that lead to unreliable outcomes is obviously not a position we want to be in. So we're taking this work forward as quickly as possible. Tom Peterkin from the P&J.
Good afternoon, First Minister. The UK government has suggested it is leading on ventilator and testing procurement and distribution, but the Scottish government has said this is untrue. I just wondered if you could give some clarity on that, please.
I think we've tried to give clarity to this, and I don't think there's any great mystery here. So let me have another go. The Scottish Government is doing our own procurement of ventilators and testing kits and capacity. And so on ventilators, we have a number of orders in with different companies that are already manufacturers of ventilators, and we hope and expect to see those orders fulfilled in the coming weeks. And I gave some information of that in Parliament yesterday. The same is true of testing. So that's the case. Over and above that, and in addition to that, we are taking part in four-nation procurement, which the UK government will lead on, both on ventilators and testing. So, for example, I spoke about it in Parliament yesterday, about a new testing laboratory that has been established in Glasgow and will become operational over the next couple of weeks. That is as part of a four-nations approach to a commercial initiative to add increased testing capacity. So it's not one or the other. The four nations, four country approaches we're taking part in are over and above our own procurement, and I hope that is clear for everybody watching. Simon Johnson of the it says the Times on my list here. Simon Johnson of the Telegraph.
Yes, I should think so. Thank you very much. I just wanted to go back to testing again. One of the criticisms levelled at the UK government First Minister over the lack of testing there has been that it's meant that NHS staff are needlessly self-isolating when they've got different bugs other than coronavirus. I just wondered whether the same criticism could be levelled at the Scottish government, and whether the figure of 3,400 out of approximately 70,000 is far too low. Well,
in taking the last part of that question, we can only test the numbers that we have capacity to test. And I'm trying to set out very clearly the reasons why it takes a bit of time to build that capacity. We have done it rapidly and we will continue to do it rapidly, but there are some obvious constraints that do mean that it takes a bit of time. As we build up that capacity, we will be able to test more people, not just frontline workers, but more people in the other two categories that we've set as priorities for testing. And of course, we will then be able to ensure that testing plays the appropriate part in our strategy for coming out of these lockdown measures. And in terms of the utility of testing for NHS and social care workers, I think I and the Chief Medical Officer have already covered this to some extent. Of course it is important and of course it is useful, but I think at a briefing 2 days ago we were asked a question about NHS Tayside, who had published some figures for the NHS workers they had tested, and the question was 60% of them had tested positive. And so I think it's important to be clear that as, firstly, the virus continues to spread, and as we test more NHS workers, it will not necessarily work out that enables them to get back to work more quickly, because what we will probably find is that many of them that are being tested do have the virus, and they will be appropriately isolating. So yes, it's important that we build capacity. That's what we're doing. But I'm also trying today not to say that testing is not important. It is important, but just to try and give a bit of context about what it can achieve, but also what it can't achieve for us. And it cannot, unfortunately, lead to somebody who's got the virus getting back to work earlier than would be appropriate. But we will continue to focus on building up this capacity as quickly as possible. Chris Green from the Eye.
Thanks very much. This morning, the chairman of the Prison Officers Association called prisoners to be released on home curfew to relieve pressure on staff. I just wondered if you would support something like that.
Chris, my apologies, your link was not particularly good there, so I wasn't hearing clearly your question. I'd got that it was about Prison Officers Association and prisoners being released early. If I'm about to answer the wrong question, my apologies for that, and we'll try to answer your question later. We obviously took powers in the emergency legislation that was passed in the Parliament yesterday. We are monitoring the situation in our prisons very carefully. Hamza Yousaf, the Justice Secretary, is doing that on a daily basis and discussing that daily with me. We don't want to have to release prisoners early. If we don't have to do that, it would be a last resort, but of course we need to continue to make sure that our prisons are safe places for those that are in them. So we will continue to consider these issues very carefully. As I say, if that wasn't answering the question you answered, please let us know later and we'll get you further information. Chris Musson from The Sun.
You talked about family liaison issues and an issue at one laboratory, I think you said, for the 40 deaths not coming to light. Can you explain in simple terms how this error has come about, just in plain English? And because this sounds, very much like you might have lost track.
It doesn't mean that, and I hope both in terms of the information we give just now and further detail that we can provide later, we will assure people that that is not the case. I think I'd referred to this in my earlier statement. Part of the cruelty of this virus is when people are in hospital and when they're dying, their family members are not able to be with them. And therefore, it is taken a bit longer for families to be informed and for them to give the consent to all of the things that are required. So in some cases, that has taken a little bit longer. We have been trying to make sure that before deaths are notified and published, that families have the correct notification and consent issues. So this is a number of cases where that has taken a bit longer, which is why they haven't been notified. But in terms of how HPS will report in future using the NRS death certification process, this shouldn't arise in future. And of course, we will, in the information we publish later on, be able to show how those deaths should be distributed over the last few days so that there is complete understanding and transparency around the accurate number of deaths each day where there might have been an underreporting because of this. Sev Carell from The Guardian.
Just to reiterate the question that Chris Musson had just asked, but you did say that this was to do with one laboratory. Can you just explain that difference? If this is to do with a delay in the normal process, why is it to do with one laboratory?
I'm trying very hard when I stand at this podium to give accurate and detailed information and to be as transparent as possible. This is an issue that we are still, and that's why the briefing is slightly delayed today, we're just still trying to verify all of the information around this so that we can present this information absolutely clearly. So I'm not going to stand here right now and try to give answers to questions when I don't have all of the detail of the information. But people should be absolutely certain in one thing, and that is I want to be as transparent around this as I possibly can be, because it is in everybody's interest that that is the case, because I am relying on people across the country doing the right thing. So we will get more information, set that out. This is something that doesn't affect the overall trends of the virus that we see here, but we want to be very clear about these figures on a daily basis because it's important we are. So bear with us, and we're trying to provide information as accurately and as robustly and comprehensively as possible. Alistair Grant from The Herald.
Hi there. Mervyn King, the former Governor of the Bank of England, has warned that a lengthy lockdown is unrealistic and could lead to people rebelling against it. I think he said ministers need to work on an exit strategy. What is the Scottish Government's exit strategy, and are there concerns about social unrest if this lockdown goes on for months on end?
Well, I don't want the country to be under these lockdown measures for a single minute longer than is necessary, but nor do I want to tell people we can come out of them prematurely, knowing that if that is the case, we risk a flaring up of this virus again that will put more lives at risk. So we are already thinking about how, when the time is right, we come out of this, what the tactics and strategy for that would be. But it is frankly not possible right now to say when that will be precisely and what exactly that strategy will be, because we have always said that it will take some time, 2 to 3 weeks of these lockdown measures, to know what impact they're having. And we need to know what that impact is. We need to know what that is doing to the spread of the virus, what it is doing to the timing and expected scale of the peak of the virus, in order that we can take these decisions in an informed way. So as I said earlier on, again, we will share that analysis and what it tells us about when and how we come out of this phase as quickly as we can. But again, you know, I'm asking people and I'm relying on people continuing to do the right thing. I know how incredibly difficult it is. So it's really important that I don't stand here and say we'll be out of it in a couple of weeks to make people feel better today, knowing that I'll have to stand here a few days from now and say actually it will be longer. I'm trying not only to share with the public, and I guess I'm speaking directly to the public here, not just to the journalists, I'm trying to share with you openly the information I have, the information I know as I know it. But I'm also being honest with you when I don't know certain things yet, and therefore I can't be categoric about things. And that's part of that relationship of me being able to ask you to do the right thing and you feeling confident that when I'm asking you to do it, it's for the right reasons. And if that's the way in which we continue to proceed, then I hope we can keep the public with us as we try to do the necessary thing to get through this virus with as low a death toll and as low an impact on the National Health Service as we possibly can. Scott McNabb of the Scotsman.
Yeah, First Minister, just on the change to the way that deaths will be recorded, I'm just wondering if that is something which ministers had proactively asked to be looked into. We had some reports this week from medical professionals setting out concerns that COVID-19 deaths were being underreported, setting out exactly the kind of concerns that seem to be addressed in these changes, where it's now going to be, if it's even a factor in the deaths at all.
So there's two changes. The second one that I announced today is related to that question, and we covered this, I think, at this briefing 2 days ago, where NRS is now going to report from next week presumed deaths in the community where it's mentioned on the death certificate, and the NRS source of information and the HPS source of information will require to be brought together to give that comprehensive overview. Now, it would always have been the case that we moved to a stage as community transmission gathered pace that would be required to ensure that we were robustly and accurately reporting on deaths. The first of the changes that I spoke about earlier on is around how the current daily figure, the HPS reports, is going to slightly change. And again, that's just a feature of the number of deaths rising. So up until now, that has been effectively an individual health board notification to HPS of confirmed lab cases that have died. As numbers rise, it's not appropriate and it's not necessarily the most accurate way of doing it to rely simply on health board notifications. So they will now use the NRS death certification process to make sure that as numbers rise, that continues to be robust and accurate. So these are changes we would always have anticipated as numbers were to rise, but let me stress, it is about making sure that as we continue through this virus epidemic, that these figures are as accurate, as comprehensive and as up-to-date as possible. And I think I said earlier on, we're happy to do a specific briefing over the next couple of days on this issue where some of these questions can be properly explored so that journalists have an absolute clear understanding of the basis of reporting going forward. Vivian Aitken at the record.
Good afternoon. If I can take you back to the subject of ventilators, I know you've explained pretty accurately and fully today about the efforts that are being made to increase. But we are seeing on a daily basis the numbers of people in intensive care rising. There will come a point, perhaps, that we will see more people requiring ventilators than we actually have them. So my question is, have discussions taken place on who should get those ventilators if they're running out? Will, for example, people over 70 be denied access to them? Will people with proven respiratory conditions not be allowed to have them? Or could people already on ventilators be taken off them and them given to somebody else who perhaps has a better chance of survival?
Well, Vivian, all of our efforts right now, and literally a huge amount of time, effort and dedication from an awful lot of people is being expended right now on trying to do everything we can to make sure we don't get to that point where we don't get to a situation where we have more people needing intensive care than we have capacity for intensive care. Now, as I've explained before, there's two strands to that. There's building up our intensive care capacity, which we are doing, but there's also asking people to comply with all these rules about staying at home so that we are reducing the peak of the virus, reducing the number of people who need intensive care, reducing the number of people who need hospital care more generally. So all of our efforts are going into those two strands, which are all about doing everything in our power to make sure we don't end up in that situation. I went into some detail yesterday in Parliament about the ventilator procurement. We've got a number of orders in that over a number of weeks will take us to having around about 1,000 ventilators. We've taken steps in the interim to bridge a potential gap, which has involved repurposing operating theatre anaesthetic machines so that they can be used as ventilators. So all of this is about making sure that the supply of ICU and ventilators does not outstrip the demand from people who need that care. Mark McLaughlin from The Times.
Say the New York Times reported that they're now 2 to a ventilator. Could that be done in Scotland? 2 or more people on 1 ventilator? My question was about testing. It's been described as a Dunkirk spirit in England. I heard very carefully what you said about private labs and the need to keep this centralised in the NHS hubs. But why do we need these big NHS warships when perhaps small dinghies would do? I mean, we heard Dundee University sent their kit to Milton Keynes. So these smaller labs have got the kit, so why can't we mobilise them?
Thanks for that question, Mark. I'll maybe hand over to CMO on this, but just to be clear, we're not saying it's all one thing or the other. The Health Protection Scotland has focused on expanding the capacity of NHS labs first, I guess, as a priority, because that's the quickest thing they can do, because the issues of due diligence and quality can be much more quickly dealt with in labs that already operate in this area. But we are also exploring additional capacity, whether that's in the academic or the commercial sector, and there are other initiatives underway there. So I don't want anybody to get the impression that it is either or. We want as much capacity as possible from wherever we can get it. We just want to make sure that it is doing the job we need it to do so that the testing we're doing is reliable. Do you want to add?
Yes, thanks, Mark. The Chief Scientist for Health, Professor David Crossman, is leading on this work for me. He has been speaking to all of our universities across Scotland. There are offers of help from staff, from lab staff, but also from IT staff, and as well as offers of equipment. So what we're doing is taking all of those offers and looking at those centrally as to where could that equipment be used, what staff could be used to further increase that capacity that we've already got in the NHS. So it's a coordinated centrally, but taking those offers so that we can best use the equipment and the staff and the expertise that we have in Scotland.
And lastly, Kathleen Nutt from The National.
Hello there, First Minister. Hello, can you hear me? Yeah. Hello, First Minister. I'm just looking at the issue about the temporary hospital, and as the number of cases increase across Scotland of COVID-19, are there any plans to open a second temporary hospital, or are there any plans under consideration to look at a temporary hospital, say, in the Edinburgh area? And if so, which sites?
Not at this stage. Obviously, we keep all of this under ongoing review, but we, within our existing NHS hospital network, are taking forward plans which involve reducing delayed discharge, postponing non-urgent elective treatment to make sure we've got a 3,000 beds that are for dedicated use of COVID-19 patients, and that is within our existing hospital network. As a contingency, we took the decision to create the new temporary hospital at the SEC, the NHS Louisa Jordan, as it's now called, and that work is underway. I think it's important we have that as a contingency. I think it is likely, it is not certain, it is not guaranteed, but it is possible that we will never have to use that hospital because the capacity we're creating within our existing hospital network is sufficient. So that's the contingency step we've taken thus far. And just to recap, that new temporary hospital will give us initially an additional 300 beds over and above the 3,000 within the existing hospitals, but has the capacity to go up to 1,000 beds. So we think we would have the capacity within that new temporary hospital that would be available for us if we needed it. But I stress again that it is entirely possible, and actually I hope this is the case, that we never have to treat patients in the temporary hospital that's been created right now. Thank you all very much. We've got through all of those questions. I said on a couple of occasions that there is further information about the 40 deaths that I referred to earlier on that we're hoping to provide this afternoon. We are also keen, if there is an appetite for it amongst the journalists, to do a bespoke briefing on death number reporting going forward, because there'll perhaps be some technical questions around that, and if there were any other issues that I said we would provide more information on, we will do that over the course of the day. But to the journalists joining us, thank you, and to everybody watching at home, thank you very much for doing so, and please keep staying at home when you can to help us save lives and protect our NHS.